Well, the lowest vaccination rates nationwide are among children, and Michigan is in the bottom half of states in vaccinating 12 to 17-year-olds. We come in 33rd. Unfortunately, we have the 13th highest hospitalization rate. And some think one way of fighting the pandemic is to boost vaccination rates in teens. And that has some asking whether minors should be allowed to make the choice to vaccinate or not on their own. Vaccinating 12 to 17-year-olds will be key in slowing the coronavirus. That's according to Terry Adams, Director of Immunizations at the Michigan Department of Health and Human Services.
They are active, they are social, they are in school, they are in activities.
And they can become seriously ill. But in Michigan, that decision is left up to parents.
I think the parents should make that decision.
Once you're an adult, you're an adult. So, yeah, I believe 18.
But should older teens be able to decide for themselves? It's an ethical question, even making the pages of the New England Journal of Medicine. The argument that teens should be allowed to decide on their own, in part because they suffer disproportionate pandemic costs, like school closures.
A lot of people will initially sort of balk at the idea of a minor making a medical decision for themselves.
That's Dr. Abram Brunnett, a bioethicist at Oakland University William Beaumont School of Medicine. He says teens are already allowed to make some medical decisions without parental input. For instance, mental health, substance abuse, and STD treatments. Issues teens may be too embarrassed to bring up with parents.
Not seeking treatment for those sorts of interventions could have a really negative impact on, the minor's life, and oftentimes have public health consequences.
8 states either don't require parental consent for the vaccine or allow providers to waive consent, according to the Kaiser Family Foundation. But Michigan is not one of those states.
A teen must have their parent consent to receive a vaccination. They cannot go and seek vaccination without their parents' consent.
Dr. Brummett says physicians see issues like this all the time. Consent comes down to understanding. Doctors call it decision-making capacity.
So applying it to themselves and sort of thinking through how it would affect them in their lives.
Many healthcare providers believe teens as young as 14 have the ability to make their own decisions for care at the level of approved vaccines. Adams says one of the biggest concerns she hears from parents are about the rare cases of myocarditis, a treatable inflammation of the heart muscle primarily found in young men. It's enough to keep some parents and their teens on the sidelines.
Yeah, we're lagging behind, and we've got some room to grow.
Now, the only teens who don't need parental consent are emancipated teens, married teens, and some homeless teens. Here in Michigan, any teen that wants the vaccine will have to persuade their parent to allow them to get the vaccine that has been proven both safe and effective in preventing severe disease and death. And there are lots of resources out there to help teens with what can be a touchy and possibly politically charged conversation. MDHHS has great information about the vaccine on their website, and so does a website called VaxTeen. It was created for teens by teens and covers all routine vaccinations, not just the COVID shot. And I Vaccinate, which is a website that was created by a parent who lost their child to a vaccine-preventable illness, is also a great resource to begin that conversation.